Welcome to the Hashimoto's Doctor Podcast. You're now part of a growing community of people determined to take their health back through education and self-empowerment. But because of the healthcare system today, we don't have access to the types of healthcare that we want. So we have to do things differently. We've got to do things smarter, and we do that by becoming our own advocates. This podcast will give you the perspective and thoughts of one of the world's leading Hashimoto's doctors. So let's get started. Hi everyone, Dr. Shook here. I hope you're doing well today. In today's podcast, what I want to talk to you about are thyroid antibodies. And this is something I've discussed in various videos and live streams and in question and answers sessions, but I'd like to address it here because I think it's a really important topic. There's a lot of confusion surrounding it, and I want to give you my perspective on thyroid antibodies and what they mean. Can you expect them to come down? If they come down, is that necessarily a sign of remission of Hashimoto's? What is actually happening, and what does it mean? What does it mean for you? Okay, so first and foremost, a lot of people, when they get diagnosed with Hashimoto's, they really fixate and they look at their thyroid antibody number. And they look at the total quantity of those antibodies. And what I'm referring to, if you have Hashimoto's, then you have either thyroid peroxidase antibodies, which are TPO antibodies, or you have thyroglobulin antibodies. And so those are the most commonly measured and checked antibodies. Those are the ones that correlate with an autoimmune thyroid process. And a lot of times, people are really fixated on those numbers. They find out that they have Hashimoto's. They look at their laboratory report. The laboratory report shows that their number is, let's say, 1,500 for their thyroid peroxidase antibodies. Or it's pegged off the charts. It says, some of the labs don't measure those values above a certain number. So it's at, greater than 600, or I've seen it greater than 3,000, and the lab just caps it. Right? They don't evaluate it. They may not have a way to quantify it beyond that. So with these antibodies elevated, people think, okay, I have Hashimoto's and the antibodies are the bad guys, right? I've got to lower those antibodies. And they're fixated on lowering those antibodies, and they think if those antibodies are normal, then they're fine. And that's not exactly true. First of all, I just want to make this statement to kind of, give you my perspective and the perspective of a lot of other people that are that I've learned from in my clinical experience, and that is you cannot use the antibodies, the thyroid antibodies, as a way to determine the status of your autoimmune condition. So if your antibodies are low, does that mean you're better? Well, I mean, most likely it is an improvement. It is an improvement that the immune system has calmed down. However, we know that the antibodies fluctuate significantly. So if you check them, 2 or 3 times in one day, they might fluctuate up or down significantly. So, are you really better in a 1 day or 2 day or 3 day time if the antibodies are half the level they were? Or is that just a reflection of the immune system and how the immune system responds? The other thing is that, very commonly we see people that have they've had autoimmunity for a long period of time. They have low or lab low, they have suppressed, so let me say this, white blood cell total count. Okay, their white blood cell total count is below 5, or it's lab low, which is typically below somewhere around the lab ranges are all different. They're all different around the country, but typically somewhere below about 3.4 or 3.2 is considered laboratory low as a total for your white blood cell count. So I'll find that people that tend to have white blood cell counts below 5 or definitely, laboratory low, they tend to have a lower capacity to actually produce the antibodies. So the antibodies actually may be negative on the test. However, they still have the autoimmune process occurring. Their immune system does not have the competency to produce the antibodies at levels that are detectable. So as these people start to get healthier, as their white blood cell count starts to improve, you may see that they actually start testing positive for Hashimoto's where they didn't in the past, right? So it's really important to understand that there are a lot of nuances here and not to get too hung up on these levels. They don't correlate, the antibodies don't correlate. There's no research that I've seen that shows that they correlate with severity. So higher antibodies means a worse autoimmune condition or worse expression of the autoimmunity. or where lower antibodies necessarily correlate with improvement. I mean, you really have to look at it as an on or an off switch, and if it's been expressed as high, lab high at any point in time, then you say, okay, the autoimmune process has been turned on. It's a genetic expression. We can't turn it off. We can work to down-regulate it to decrease its expression. We can focus on decreasing the immune system's attack of the body through trying to change things in the environment that influence the genetic expression. It's called epigenetic expression. And so if we can focus on these factors that drive the immune response, that's usually where we get improvement. But you can't, I think it's a mistake to look at it and try and correlate the autoimmunity with, and try to determine severity or remission based on the thyroid antibody levels. Some people, they don't see improvements in their antibodies for years and years, and that's after doing everything right. And so you've got to understand that it becomes very complex because there are a lot of things that drive the immune system, and it's very hard, even with the best testing that we have and doing everything correctly, to in some of these cases to get everything figured out. It's just incredibly complex. So what we're really looking for is are signs of clinical improvement, symptomatic improvement, improved. If we're dampening the autoimmune process, then you're likely going to see improvements in thyroid hormone physiology, better thyroid hormone conversion. You'll see inflammatory levels come down. You'll see improvement of sensitivity of the body to the thyroid hormone. So focusing on the antibodies, I think is a mistake. And I think a lot of the major thyroid associations, they agree with that statement. They say, it's not a way to monitor the autoimmune condition. It just fluctuates too much. And so I think it's a very good way to help us determine if there's genetic expression, if there's an autoimmune process has been initiated, and lets us know that it's turned on, right? And again, we don't know how to turn off the autoimmune expression, but our goal is down-regulation or dampening of the genetic expression of autoimmunity. And we do that through investigating the drivers of the immune process to the best of our ability, right? So we're looking at food peptide reactivity, so partially digested food protein immune system reactivity, pathogen reactivity, which is an umbrella term for a lot of different bugs, and then looking at environmental chemicals and toxins and their reactivity, looking at nutrient deficiencies and the role that they play in your body's, if you're having problems, your body's inability to carry out normal biochemistry. And these are all extremely foundational, right? You've got to look at the foundational chemistry and see if that can be carried out normally. And then you work on these drivers of the immune process as well. And that's where we tend to get some very significant improvements in the person's overall health. So I hope this is helpful. This is not, I know a lot of people just give me something that's very tangible that I can grasp and that I can hold on to that tells me I'm moving in the right direction, right? That's what they're looking for. And it's tough. I mean, really the overall improvements, you're probably better looking at some of your more standard physiological markers that you would get on standard labs and your symptoms and how you're trending there than to look at some of these immune-based markers, because I mean, even immune chemical reactivity to foods, partially digested food proteins. These things take a lot of time for them to the antibody levels to drop within your body if they're high. So looking at am I reacting to foods again? Well, I mean, the earliest I would recheck foods would probably be 6 months, right? Recheck a food reactivity panel, or pathogens. It's going to take a long time for a lot of these immunoglobulins that we measure, like IgG immunoglobulins, to lower. So I think the best way to really try and help is to, if you're trying to grasp onto something or hold onto something or use something as a way to monitor, I think looking at how you feel and how you're functioning is critical. And then, probably secondarily looking at more of the standard labs that we tend to order if there's any alterations there. Maybe looking at micronutrient status, your vitamins, minerals, essential fatty acids, those things to see if they're in balance. Inflammatory chemistry, those are going to be better ways to help you kind of have a gauge of something that you can measure that's going to really reflect function more so than looking at these antibody levels, because they're just very difficult to interpret and they fluctuate quite a bit between from person to person and, depending on the circumstances. So anyway, I hope this helps you to better understand some of these nuances of thyroid antibodies. And, this applies in a lot of ways to other autoimmune conditions. So I hope this helps you to better understand kind of what I think about when I'm looking at antibodies and what you might want to consider when trying to interpret what they mean. But I hope you have a wonderful day. I appreciate you hanging out with me today. If there's anything that we can do for you, please do reach out to us to let us know. It's my goal to help educate you so that you can be your own advocate. You can be better partners with your healthcare providers, and you can ultimately, be an active participant in your healthcare and not be a bystander, right? So there's a lot of information and things available. My mission is to continue teaching and trying to empower you so that you can be a better partner, right? Not a dictator. Your doctors are trying, but they're overwhelmed, and there's a lot of information that's coming at them, coming at you, and so they have to stay with what they know and what they feel like is best in your best interest. So don't be frustrated if you come in with a lot of information. You say, "Yeah, I found this great guy on the internet." That's typically a red flag. Just so you know. Even I have to sort through what people bring me and okay, what do I know? What do I think I know for sure, right? And then how can we best help you to figure out what's going on here without complicating the situation so much that you can't make any sense of what you're doing or why you're doing it. So it can be challenging, but hopefully, all this information helps you out. It's my mission to help change one person's life at a time. I know if I can do that we have the best opportunity to change the world. Because if I can change your life, if I can help you improve your quality of life, then we can ultimately, improve your family's life, improve your community, and then that has a ripple effect. So one person at a time, that's our mission. But I hope you have a wonderful, wonderful day. Thanks for hanging out. I hope this helps you out. Let us know if there's anything that we can do for you. Thanks. Thanks so much for listening. We hope you enjoyed hanging out behind the scenes with Dr. Shook. You can also talk with and learn from Dr. Shook through Facebook Live on our Facebook page at the Office of Dr. Brad Shook. Don't forget, you can also get access to our videos, guidebooks, and thyroid programs at www.drbradshook.com. Oh yeah, and don't forget one more thing. We can change the world one person, one family, and one community at a time. Until next time, remember, today is your day, and no one will tell you who you are and what you can be.